let's not waste any time. Let's start. Uh,
Sure.
could you please, in short, just tell me what you do on a daily basis, who you work as?
Okay, so my name is Dmitry Yanikiev. I'm a professor of urology. I am professor of urology in Tel Aviv University and work as a surgeon in Rabin Medical Center. At the same time, I'm professor of urology at Vienna Medical University in Austria and work as a professor in Vienna. And uh, this, to cut a long story short, I'm also a professor in Moscow at Sechenov University, and this is the place where I started working. And I'm editorial board of several main European and American urological journals. Uh, I'm at the board of European Association of Urology and Urology Group. And my main focus of interest is endourology and minimally invasive treatment of prostate cancer.
Mm-hmm. That's a lot of titles, a lot of work to do. So I
Yes.
suppose you have to be a leader a lot of the time.
So for a long time, I was the deputy director for research in Moscow, in Sechenov University, in urology department. This was one of the biggest urology department in Russia, and we built the team from the beginning. We built a team of research and did a lot of research in that department. And now I'm just continuing working in different departments and continuing doing the same job.
Mm-hmm. When you lead people, you must have a certain set of values that you want both yourself to follow and others. So, my first question here would be, how do you communicate your values and what even are they to your teams, both in clinical and research settings?
Well, it's a very good question. First, people who are involved should be interested, so they should understand why they need it. And if we talk about research, for example, in medicine, so people and students and PhD students and medical professionals, so they understand that they move the research forward. So they help people, they investigate something new, something interesting, and they present this material in the leading international meetings. So they publish their study in the leading journals. So, and of course, it's very, very interesting and insightful. So regarding medicine, so on the other hand, regarding medicine, so regarding doing surgeries, because all our research in medicine is combined of research and some um, medical medical treatment. So, and regarding this, so first of all, of course, people help patients, so students involved in these projects, and of course, they are very, very insightful and interested on that.
Mm-hmm. Okay.
Moreover, it allows you to communicate with different people all over the world who are doing the same job. So, and of course, it's also a very, very interesting part of this job.
Mm-hmm. I like that. I like that.
So yes, you become a member of this research community all over the world, and there is no borders. So you communicate with different peoples from different countries, and become a lot of friends. So this is also a very important part of this studies.
So it's all like a one big friend group.
Absolutely, absolutely, and frankly, the most of friends of mine all over the world, they are urologists, because I spend most of my time I spend in my job, and of course, again, more and more friends in my research projects, in um, medical, my medical professionals. This is how it's going on.
So, what would your vision for the future of urology, both as a medical discipline and a research field, is?
Well, now we are moving forward. I think that currently urology is one of the most actively professionals. So we do a lot of projects, we do a lot of research, we do a lot of innovations, and I think that the future step of medicine, the future step of urology, is that we can treat very difficult, very hard diseases without surgeries and with only with medical treatment. And I think this is an important step. So we got an important improvement in cancer treatments, in kidney cancer, in bladder cancer, and now we can treat even advanced disease. We can treat successfully, and I think this is an important step of this in this direction.
Yeah, it's incredible how the medical field is pretty much it doesn't really move humanity forward, but it saves so many people's lives and it makes them so much better. It's kind of what always inspired me about that. Unfortunately, I didn't follow in my father's footsteps, but you know, to each their own.
So it's really so, and for us, for medical professionals, Nobel Prize is a real sign what is going on in the world of medicine. A Nobel Prize for medicine, and over the last 6 7 years, we got several Nobel Prizes for oncology treatment. So we have new checkpoint inhibitors, immunotherapy for oncological diseases. We have HIV inhibitors for oncological diseases. So, and it's really great success in future in treating even advanced diseases.
Mm-hmm. Okay, got it. So the medical science is always evolving. And you must be evolving with it. So how do you, in your teams, in your work, encourage innovation and challenge established practices in the field? Because as you're saying, there are always new and new uh, ways of treating same diseases or uh, new advancements that allow you to treat diseases that were previously untreatable. And that by itself means that somebody decided to challenge established practices or encourage innovation. So, how do you do that?
Well, the path of urology, the path of all medical professionals is always learning. So it's very important because every year we have new technologies in different directions. For example, nanoknife, reversible electroporation, cryoablation, freezing of tumors, brachytherapy, radiation, focal radiation therapy. So we have many robotic surgery with Robot Da Vinci. So we have many different technologies, and we have to learn them. So our way is always learning. So we should always visit all the medical conferences, uh, travel for learning. The many urological centers and travel there, learn new technologies and use them in our medical practice. So there is no other way. There is no other way.
Mm-hmm. And along the way, with so much new stuff coming in, there must be sometimes some setbacks or failures. So, how do you handle them both personally and as a leader of your teams?
Well, it's a very complicated question. So because frankly, all medical professionals have their own mistakes, and sadly, and well, it's a big problem. But the main issue that you should always think about your patients, and always you should always you should always take care about your patients, and there is no other way. And you should spend all the time with the patients and try learn a lot and try to minimize any type of mistakes in your professional career. But sadly, sometimes it happens, and the only one way is to minimize them to learn more and more and more. This is the way.
Mm-hmm. Got it. And with your field being so cross-cultural, cross-border, uh, maybe we can even say no-border field, there new young professionals are always coming in. So how do you encourage junior doctors, researchers, maybe even students to take initiative and grow in the field? Because it's so vast and for me at least, it's unfathomably vast. So youngsters, if we can call them that, must be getting lost sometimes. How do you encourage them?
Well, it's interesting question. I usually give priority to not to the clever guys. I give to the guys who are ready to work hard, and this is the main issue. So you should work hard, should be ready for that, and this is the way to success. So if I see that the person is ready to spend all his or her time at work and ready to be involved for 150%, so this is the person that I choose and invite to work with me.
Hmm. So you set expectations clearly from the very beginning.
Absolutely. So the person who is not ready, the person who is um, not ready to be involved 100% is not cannot be in my team.
Okay, that's very cool. Your team must be killing it. Um, and when everybody performs great and there's cause for celebration or maybe even praise, how do you recognize and celebrate achievements of your team members? How do you keep them motivated during both good times and challenging, stressful times?
Well, I always try to find some grants, some support for my residents who have success, which, for example, if they send some abstracts to the international conference and scientific committee accepts their abstracts, so they have their presentations. So I try to find any grants, any support from the university or from different organizations for traveling for them, so to come to this meeting and to present their research. So I think this is a very important step. So on the other hand, I try to find hello.
Da.
Uh, can you hear me?
Yes,
Yes.
yes.
So once again, so I always try to support. My residents, my PhD students. So uh, with if, for example, they send their presentations, their research reports to different conference, and the scientific committee accepts their presentation. So I try to find for them different grants, different support for traveling and present their research. And on the other hand, I always try them to be involved in in surgeries activity, and teach them to do surgeries. And this is also an important part of this activity from their side.
So for them, recognition would be um, recognition and acceptance of their work professionally would be a certain type of praise.
Sure, sure. When they can present and present their report in one of the leading international conference in U.S. or in Europe, and among the leading experts from all over the world. Of course, it's a great opportunity and a great honor for anyone.
Mm-hmm. Got it. So, two questions to wrap it up. What do you think is the most important quality of an effective leader in medicine and research?
Well, I think that important issue is delegate opportunities. So when you gather the team. You should always give them options, give them options to move, give them options to do something without sometimes without your under vision. So it's important to let people uh, improve themselves, to let people move themselves. So this is, I think, a very important issue. Not always control them for 100%. Let them move forward themselves, and this is an important issue. And for the leader, I think it's also important always to find a moment when you can let your students move forward without you. So when you see that he's strong enough, he or she's strong enough, let them move forward without your guidance. So not always leave them under your supervision. So I think this is also an important point.
Mm-hmm. And the last one, over the years from university time, for example, when you might have led small assignments, group assignments, to now, how has your leadership style evolved?
Could you please repeat your question? I didn't catch it once again, please.
Yeah. So over the years, from let's say your university times when you might have led some small group assignments, to now when you are a world-renowned professional, how has your leadership style evolved?
Well, I think that when you spend more and more time with people, you also when you teach them, you also learn uh, and this is important. So you always learn how to communicate, how to find optimal way to discuss everything, to explain everything. So important things. So this is an important thing for me. So when I teach, at the same time, I learn a lot. So and I learn not just in my professional, but also in my communication skills. So I try to find the optimal way to communicate with people in different situations, and this is also an important advantage of this process.
Got it. Thanks a lot for your answers. I really appreciate it.
Yeah.